Good afternoon, everyone. Imagine you walk into a hospital and you see nobody is wearing gloves or a gown or mask. Will you feel safe to be treated there? Most of us will not feel safe. That's because we trust our healthcare professional to take the necessary precaution to prevent themselves and the patient. In fact, according to the Center of Disease and Prevention, in any given day, in every 31 hospital in the United States, one of the patients has at least one healthcare associated infection. This highlights why infection prevention remains top priority in healthcare setting. Today's briefing focus on personal protective equipment, commonly known as PPE. I will explain what PPE is, the different types in healthcare, and why it's essential, and how proper used to help protect both healthcare workers and the patient. First, what is PPE? Personal protective equipment refers to specialized clothing and equipment worn to reduce the exposure to infection disease and other work hazards. Depending on the situation, PPE may include gloves, surgical masks, N95 respirators, gown, goggles, and face shield. The type of PPE selected depends on the task being performed and the level of exposure of infectious material. According to the World Health Organization 2024 guidelines, proper PPE is one of the essentials measured for preventing the transmission of infection diseases in healthcare setting. However, PPE is not only effective when it's selected. PPE is only effective when it's worn or removed correctly. Think of PPE like a seatbelt. Seatbelt will not prevent the accident, but it will prevent the serious injury. Similarly, the PPE will not prevent every infection, but it will reduce the risk of infection. Now we understand what PPE is. Let's take a look. Why is it important? Why do we need to wear PPE? Healthcare workers are exposed to blood and body fluid and respiratory droplet, other potential infections material. Without proper protections, they are risk being infected or transmitting the diseases to their friends, family members, and patients. Each piece of PPE serves specific purpose. Gloves protect the hands from contaminations. Mask and N95 respirators helps protect the nose and the mouth from infectious droplets and airborne particles. Gown protect cloth and the skin from contamination, while goggles and face shield protect the splash and spray of the infection materials or the body fluids. According to CDC 2024 guidelines for healthcare personnel, selecting appropriate PPE based on level of exposure is one of the most effective ways to reduce healthcare associated infection and improve workplace safety. Thank you for listening, and I will be happy to answer any question.